Each and every human being is conceived in the same way, but by day 22 in our mother's womb, every 1 in 100 of us will be affected by congenital heart disease. 1 in every 100 children will have a heart that is different. 1 in every 100 children will be placed in a special league of heroes that we call heart kids. We do not conclusively know what causes congenital heart disease, but we know this. In South Africa, every day as many as 30 heart kids are born. Only 12 of these heart kids will be diagnosed and receive a chance at treatment. This is our story. This is their story, but this is also your story. We welcome you to a world where your own heart is your greatest ally and in some cases, your worst enemy. Welcome to a world of tubes, drips, beeping monitors, a world where parents constantly monitor the oxygen levels in their child's blood. This is a world where medical teams can help, but they cannot cure. A world where you greet your hospital with, "Until next time," instead of "Goodbye." This is a world where your greatest fears are placed on repeat. Repeat appointments, repeat surgeries, repeat infections, repeat, repeat, repeat. This is also a world where miracles repeat. Medical staff who give everything to save our heart kids repeatedly.
Good morning, I'm Kenny Govensdrageloo. I'm the pediatric cardiologist for Wyatt. I've been taking care of him since he was a newborn baby. He was born with quite a complex heart problem with the coarctation of the aorta. So that's a narrowing of the aorta as the vessel turns to go down to the lower half of the body. In addition to that, he had quite a large hole in the heart, as well as having an aortic valve with only 2 leaflets, bicuspid aortic valve. Now, Wyatt's problem is quite complex as it affects the left half of the heart, and as far as congenital heart disease goes, it occurs in about 1% of patients, and one needs to see it as a spectrum of problems where children are born who are pink, which was Wyatt's problem, and other babies who are more complex who are blue, where deoxygenated blood shunts across and goes to the body. You can get complex heart problems where children are pink, which Wyatt falls into, and you can get simple problems when babies are pink as well and they have isolated defects. What's important is that it's necessary to make a correct diagnosis soon after patients are born so that a management plan can be formulated as to what treatment the child needs, when will the child need to be presented for surgery. He needed his surgery soon after birth, and because of the complexity of the problem, it had to be done in 2 stages. First operation was successful. We waited until he was much older, where we were able to do a follow-on procedure, what we call a hybrid procedure, which was done in conjunction with the cardiologist as well as the surgeons in theatre. And quite a unique procedure in that we were able to close the hole in the heart with a occluding device, and it worked very, very well. He's one of 3 patients that we've done hybrid procedures on to close residual holes in the heart using an occluding device. As far as congenital heart disease goes, there are certain areas in South Africa where patients have access to pediatric cardiologists, and they would mainly be in the urban centers of the country, particularly the 2 big units in private is at the Sunninghill Hospital in Johannesburg, and then the Christian Barnard Memorial Hospital in Cape Town. Smaller units are present elsewhere, and there are pediatric cardiologists in the state as well as in the private sectors. Prof Kinsley, since he has retired, is working with Dr Darshan Reddy at the Ethekwini Hospital, and there are plans afoot to start a foundation to assist children born with congenital heart disease who do not have access to private health care. And those patients tend to be managed in public hospitals And unfortunately, due to lack of resources and other challenges, those patients may not readily be presented for surgery where correction or palliative surgery can be done.
Children with scars on their chest are a constant reminder that they cheated death repeatedly. Individuals who come out stronger on the other side because they beat the odds.
I am 1 in 100 children born with a congenital heart defect. I was born in 1997 in St Mary Clinic, and my heart defect was only picked up when I was 6 weeks old. I had my first heart surgery, which was a Blaylock shunt put in through my back when I was 9 months old. My first proper open heart, I was 2.5 years old. Then I had another open heart when I was 8, and again when I was 13. I've had multiple catheterization procedures, including a balloon surgery to try and open up my valve prior to my last open heart surgery, but that didn't work. I've had a loop recorder implanted in my chest to monitor my heart rate. And to this day, I'm healthy and still alive, and I am happy. And special thanks to Prof Kinsley for everything he has done. I wouldn't be here without him. To Dr Dansky for being my cardiologist for 21 years. I don't know where I'd be without you. And just to all of them who work so tirelessly to help children like me live and fulfill a happy and special life.
I'm the general manager of the Lenmed Ethekwini Hospital and Heart Center. At the outset, I must sort of confess I'm extremely honored to be heading up this cardiac center of excellence, and more so of recent having sort of set up the dedicated pediatric cardiac unit at this hospital. We're privileged to have on board Professor Rob Kinsley, internationally renowned pediatric cardiac surgeon, and our resident cardiac surgeon, Dr. Darshan Reddy, and other members of the team, Dr. Himal Dama, our resident pediatric cardiologist. Going forward, our vision is to create a foundation for deserving patients, and we can only do this with the support of the wider community and the corporates out there in the marketplace. If you are watching this and if you are able to make a difference, please feel free to contact me or visit our hospital website at www.ehhc.co.za.
I'm Darshan Reddy, and I'm a cardiothoracic surgeon at Lenmed Ethekwini Hospital in Durban. We operate on adults and children, predominantly with congenital heart disease. We started a pediatric cardiac center at Ethekwini Hospital on the 1st of March in 2017. And the reason for this was that Kwazulu Natal had no pediatric cardiac service, and all the patients in this province were referred out to either Johannesburg or Cape Town for surgery. We felt that being the most populous province, we required our own service. And after having spent a year training in the United States and returning to South Africa, I decided that Lenmed Ethekwini was the perfect place to start this unit. So Lenmed Ethekwini Hospital is uniquely positioned in that we have all the pediatric subspecialties under one roof. And this is particularly important in pediatric cardiac surgery, where we often need the support of other pediatric subspecialists such as pediatric neurologists and pediatric nephrologists. In addition to that, we have a dedicated team of pediatric cardiac anesthetists. We have perfusionists who are highly specialized in dealing with children, especially newborn babies. And our ICU and theater facilities are geared towards neonatal as well as infant cardiac surgery. In addition to the fact that we have all the pediatric subspecialists, we also have dedicated pediatric cardiac theaters, and we're building a brand new theater complex with a pediatric cardiac theater as well as a pediatric post-operative intensive care unit just dedicated to children with congenital heart disease.
I'm Professor Rob Kinsley. I recently relocated to Ethekwini Hospital in Durban. Pediatric congenital heart disease is extremely common. 1 in 100 children are born with congenital heart disease. And Kwazulu Natal is one of the largest provinces in South Africa. There are enormous numbers of children with congenital heart disease. The sad reality is that a tiny fraction of these actually get treated and the congenital heart defects corrected. We know that with surgery you can correct these children completely. So a child is born with a congenital heart defect, given the opportunity of corrective heart surgery, can live for 70 years. Certainly in Africa and also in South Africa, but perhaps to a lesser extent, it's what I call continental genocide, when you don't treat children with congenital heart defects. It's mandatory that these kids get treated. You know, it's my firm belief that no child born with a congenital heart defect should be denied corrective open heart surgery. We need to establish a foundation, Ethekwini being a prime example of a unit which could really do a lot of good given the necessary funding. So I just think it's absolutely mandatory that we find the funds, that corporate support it, that individual support it. And you know, there are so many children that are testimony to the efficacy of open heart surgery for congenital heart disease. You know, they're now grown-ups, and they now bring me their own children, having had surgery themselves as neonates. They come and see me 30 years later and show me their own children. Now, what sort of surgery can be as effective or as cost-effective as that?
This is your story too, because no matter how long or short your journey with one or many of these special heart kids will be, you can never take life and a beating heart for granted again.